Hey everybody, happy Wednesday. We're going to let some people jump on here and then we'll get going. We have a great presentation today, really excited. Hope everybody's October has been fabulous. Hard to believe it's the end of it. Not ready for winter. Anybody else? Takers? No? All right. Well, I know we have a lot to go through. So as everybody's jumping on, I'm going to get through the beginning here. First off, I want to say thank you to everybody for joining us today. This is the 2023 Professional Webinar Series presented by Harmony Foundation. My name is Christy Weeks, and I am the Brand and Digital Media Manager. So let's see if I can get we talked about technology working earlier, and I don't know if mine's going to. There we go. So today's presentation is Wholehearted Journey to Ethics, Compliance, and Leadership using the research-based work of Brene Brown. Our presenter today is the lovely Maeve O'Neill, and she is with Circa Behavioral Healthcare Solutions. So as we go on, a little bit about Harmony. I wanted to let you all know that we have, is anybody hearing feedback or is that just me? The chat box is open. If anybody's got problem with the audio, let me know, okay? So we are located on 43 acres in Estes Park, Colorado. We are near the Rocky Mountain National Park and it is beautiful. 54 years of treating addiction. We've been around since 1969 and we are going strong. So I am not sure why I have feedback this time. We are an abstinence-based program. So as we continue to look at Harmony, we are a 70-bed residential program. We have a full medical detox, and we also have a very robust virtual IOP program. We offer 3 different options for our virtual IOP, and we recently just added the IOP app, which helps our clients track when they're not in session with us. So if you get a chance, take a look at that on our website. It's pretty fabulous. We also have a very, very strong family support and education program and alumni support services. We have a huge, robust program that we're very, very proud of. So this here is our Swickard building. It's always my favorite. We do have an individualized gender-specific treatment program. We are evidence-based and very, very 12-step program. We offer a lifetime of support for alumni and its family members. And if you have any questions or would like to learn more about the Harmony Foundation, you can visit us at harmonyfoundationinc.com or give us a call at 970-586-4491. Happy to help with you. Okay, things to know about the webinar today. First off, this is being recorded and will be accessible on our website by end of day on Friday. So we also offer a CEU for this, and it will be emailed to you by the end of day Friday as well. But you must be involved in the program for at least 45 minutes. And we do have a program that tracks your time. So if you happen to jump off early, let me know. I can get you a certificate of attendance versus the CEU. And last, please complete the survey. If you are not around at the very end of the webinar, usually when the survey is generated, it will be included in the email that I send to you with your certificate. So if you get a chance, please fill that out. We love hearing your feedback and gives us an idea of what we should be looking for in the future for presentation. All right. So as I mentioned, our presenter today is Maeve O'Neill. She's with Circa Behavioral Healthcare Solutions. I have a very lovely full bio for you right here. If you would like to learn more about her, Maeve, is your bio on the Circa website by any chance?
It is.
So
yes.
You can check out that website instead of me reading to you. I would highly suggest you do so. Their website is circabehavioral.com, and we are so grateful for them for loaning you to us for an hour. We've been looking forward to a great ethics presentation. And with that, I'm going to turn myself off and turn this all over to you. And everybody, if you have questions, please put them in the chat box along the way, and Maeve will be happy to answer those. And we'll get started right now.
Thank you. If you don't see my screen, I guess you'll let me know, but hopefully it's showing now, given my technology challenges. Well, thank you all for joining. I'm really excited to be here. This is one of my favorite presentations to give. I'm lucky enough to be able to do this often and present webinars and different podcasts and a presentation of workshops, conferences around the country. And I think it's so great when we get to connect with each other and support each other in the work that we do. So thanks for taking the time today out of your busy days. So I'm Maeve O'Neill. As Christy mentioned, I've been in this field for a really long time. 35 years now is my story in this field. I worked the first 10 years or so in the Northern Virginia, DC, Maryland area, really with every population. I work with young people, with youth, with families, with adults in treatment centers all over the area there. Then I spent about 10 years in management where I ran residential and outpatient programs, did some college teaching, did some private practice, sort of work in all kinds of different settings. And then we packed up the RV and moved to Texas in 2006. And since coming here, I've been really fortunate to kind of enter the corporate world of behavioral health, where I've run states for nonprofits. I've run treatment centers across the country for-profit and private equity firms, turnaround startups, all of those exciting kinds of things. And lucky enough, about 8 years ago, I fell into a job where they asked me to do this compliance work, which for me, as many of us in the field, we don't hear the word compliance a lot. We hear quality or safety, maybe risk management. We got lots of words for this area of compliance, which is actually a very specialized healthcare field. When I discovered that, I then got certified in healthcare compliance and have now worked in that. And as a member of the circuit team out of California, I get to work with a team of folks who help treatment centers, mental health, addiction centers all over the country just to improve their care overall, from starting up, opening up, to continuous ongoing compliance to state and Joint Commission, CMS, CARF accreditation standards. And my most proud certification I have is being a certified Dare to Lead facilitator. So if I was in person, I would ask any of you who know who Brene Brown is. We'll talk about that a lot today. But I was lucky enough to get trained in her work about 8 years ago. It just really changed my life. So you're going to hear that today and how I apply that to the work of ethics and compliance, and really gives us a roadmap of how we can do it in all the work that we do. And you'll see there at the bottom of my title is a title called Chief Heart Officer. This is not my job title. I call it my aspirational job title because I hope every day that I'm serving in that capacity. By the end of today, I hope all of us want to do that at the places that we work. Now I'm going to try to change my slide. There we go. Well, I like to ask people who work in behavioral health, what is your biggest leadership challenge, your ethics challenge that sort of keeps you up at night? And usually what I hear a lot today, especially, is staffing or coverage issues, or are our people okay? This is probably true pre-pandemic, but certainly post-pandemic, we know that as a people, we're all very stressed. And certainly those of us that work in healthcare, in particular behavioral health, we are definitely stressed. We know we're seeing more acute clients. We've got harder payer environments to work in. We certainly have increased regulatory environments like I'm bringing to the table all the time. And then we have the challenges around just everyone's daily lives and the work and the things that are going on, very high stress times. So I often hear about burnout and I hear about turnover in the field. So those are the biggest challenges I think we can talk about today. And I'll hopefully give you some good tools that will help you navigate those in your work. I'm sorry, go back to this. So we're going to talk about how you're going to prevent burnout. What does that look like in our daily lives? What do we do in our schedules to maybe prevent that from happening to us or those around us? And how do you reduce turnover? If you've got people leaving your programs, not staying very long, that's going to impact burnout and also impact the quality of care that you can provide. And then lastly, the culture in organizations. Is it healthy? Is it happy? My biggest sort of mantra right now is happy and healthy people are ethical and compliant to provide quality and safe care. And I think if we're going to do that, we have to address all these issues, and we can do that. So that's what we're going to cover today. We're going to talk about how ethics is really a combination, I believe, of our individual resilience, us as individuals that show up to work every day as professionals in the field. The regulatory environment, how do our teams work together to navigate all the things that have to happen in a day's time in the treatment centers that we work in? And then reliability. This is that high reliability of predictable, standardized systems that impact the quality of care. That's, I think, what ethics is about. It's not just one thing, it's all these things together that allow good care to happen. So we're going to talk about preventing burnout, the solutions to turnover, and how to enhance our cultures. Please put any thoughts or comments or questions you have in the chat. As Christy mentioned, we'll be answering those as we go along and maybe having some good conversations as we do that. I'm happy to just share my story throughout the day, but if you all have these, I'd love to also incorporate those things. But first, before we get started, I always have to give us a little disclaimer. The truth will set you free, but first it might piss you off. And I'll try not to curse since this is being recorded and children may see it. But the truth is, sometimes when I talk about this, it seems to maybe get people a little bit upset or triggered in a way that is almost uncomfortable. I once did this presentation in a treatment center years ago, and the person that invited me was in the front row, and he was listening and paying attention. He seemed to he really enjoyed it. And then I saw him at a conference a few months later, and he said, Maeve, when you were at my presentation at my facility, he said, I was liking it and enjoying it because I was applying it to my coworkers or my boss or my wife at home. He said, then I got home and I realized, oh, she means me. I have to be doing this work. I'm the one that has to change. He said, and I was mad at you. I didn't want it to be about me. I wanted it to be everybody else who needed to make those changes. And I can relate to that. Only everyone else would do something different. My life, my job would be easier. But this work is going to hopefully challenge you to look within and look at ourselves and what can we do differently in order to make all these things possible. So if you get upset, let us know, put it in the chat, reach out, and we'll work through it together. And since that is the case, sometimes I like to start by just doing a quick breathing exercise. In my burnout story, what I realized is I wasn't breathing sometimes. I was so hyper-focused and drinking enough Red Bulls to get through the day that I just didn't breathe to regulate. So I love this box breathing exercise. Brene Brown taught it to us in our training. It's what yogis use. It's what the Navy SEALs use. I like to do 3 counts in. Then you hold for 3 counts. And you exhale for 3 counts. And then hold again for 3 counts. So if you'll engage with me, this quick little breathing exercise, close down your eyes if you're comfortable, or keep them open, maybe just rest them quietly, lightly down, just so you can feel a little more relaxed and just looking up. We'll take that first breath in together. 3 counts. Hold for 3 counts. And out for 3 counts. Hold for 3 counts. Keep that next breath as you breathe in. This time, just pay attention to where you're sitting in the chair that you're in. Maybe your feet are on the floor, your back is against the chair. Any areas of discomfort, just sort of send some breath there. Try to relax it. Your shoulders and your hands and your feet. Make sure everything's just as relaxed as you can be as we spend the next hour together. And as you prepare to take that next breath in, next pay attention to what you're hearing around you. Sound of my voice, maybe something's humming in the background. It might be something that's calming, or if it's distracting, see if you can kind of push it out of your awareness and try not to let it distract you. Next breath in and holding. Next, pay attention to the taste in your mouth. Maybe it's on your tongue or the roof of your mouth. Maybe it's something that you ate or drank earlier. Maybe it's a nice, yummy taste. Or if it's something distracting, can you ignore it? Can you let it go and not let it be a distraction to the time that we're going to spend together? Next breath in and holding. Pay attention to your sense of smell. Maybe it's some yummy perfume or cologne, or you've got an oil or a candle going in the background. Again, if it's relaxing and soothing, enjoying that, letting that come in. Or if it's something distracting around you that smells, again, push it out of your awareness, try to ignore it. And your next breath in, I ask you, as you open your eyes, to put your hand on your heart, to be open-hearted to the information we're going to talk about today. It might be new, it might be different, it might be something you already know, it just reinforces that, but hopefully it's something that gets you thinking about this stuff and gives you some good stuff to take back to your work. Because here's what the reality is. When we talk about behavioral health, there's lots of data out there on burnout. If you're on LinkedIn like I am, it's every day. There's lots of stuff about burnout and how many people are burning out and how organizations are starting to look at burnout and the extensive costs that it is to an organization when people leave and burn out. The definition of burnout is really important. It is the chronic result of workplace stress due to an imbalance in job demands and resources. burnout is not an individual person. When I was burning out, as I mentioned, it's been about 9 years ago for me. I went to my boss at the time and I said, something's wrong. I'm just not myself. I feel like I'm irritable. I'm not sleeping well. Something's really going on with me. This is a boss that I had had for years. I had worked for her my very first job in 1987 and again in 2000 and again in 2010. So I knew this person for 30 years of my life. And she looked at me and she said, Maeve, I don't know what to tell you. Do more yoga or something. That was the best she had to give me when I'm telling her that I'm burning out without even knowing that word because it wasn't something I wanted to admit to. And that's, I believe, because that's the best she could really do. Maybe she herself was burning out. So to recognize burnout is not me showing up stronger and better. It's really about the environments that we are in and how do we impact those environments in a way that allows us to prevent burnout. We obviously have to do individual things, and since then, I do have a daily practice of yoga and meditation that helps a lot. But if we're going to really tackle the burnout epidemic in healthcare and behavioral health, we're going to have to look at our systems and our organizations and impact those. And then another definition that came out just pre-pandemic was the World Health Organization added it to the ICD-11 diagnostic criteria. So it's defined as a syndrome of these things. We're exhausted. We don't want to go to work. We're not good at work when we're there. We're mentally distanced from the work. We feel disengaged. And then we're really not being as efficient as possible. We're not doing as well. And that can be noticed. And sometimes that just kind of adds on to the stress of it. So burnout is a symptom, and it's something that we can look at and talk about, hopefully, in our organizations. And then also just post-pandemic, the National Academy of Medicine and Healthcare put together this rescue package for healthcare workers. And again, we can pull this into behavioral health just as importantly. That these are not normal times. Certainly post-pandemic, we have to recognize we have to adjust things. What do we need to do? What's most important? What are we acknowledging and prioritizing in our work? What stuff can we get rid of? Maybe it's documentation or processes that are duplicative or not helpful. Really shoring up staffing, which is hard when staffing is harder to find, when people are more remote. But what can we do to make sure people never feel like they're alone or doing the job of 3 people? That's never going to feel good, and it's certainly going to lead to burnout. I love the idea of recognizing EAP is not enough. If you have an employee assistance at your organization, that's wonderful. Look at the utilization of it. Are people showing up? Are they using it, and what for? And if they're not, why not? We want to know what people need. And there's this wonderful trend now. I haven't seen it yet in behavioral health. If anyone out there has done it, please let me know. But other organizations, other industries are actually hiring well-being executives, people who are dedicated to the well-being of the staff. That's their job title, that's their job duties, taking care of their people. And in fact, the job title I shared with you earlier, Chief Heart Officer, is actually someone's job title. Her name is Claude Silver. She's the Chief Heart Officer at Vayner Media with Gary Vaynerchuk, who's quite a famous viral sensation about workplace and job stuff. If you don't know him, look him up. He's quite exciting to follow. And her job as head of the heart office is to take care of people. So she takes care of their employees. She checks in with them. She makes sure everyone has a plan and is feeling successful at the work that they do. So we need someone who's sort of aware of that and taking care of that in our organizations. And then the CDC came along also and said, hey, we've got to take care of our workers. The mental health of our workers impacts the work that they do. So there's a great toolkit there you can get at CDC. It's part of the NIOSH project, which is occupational safety and health. This is around falls and hand hygiene. Mental health is up there just as important as those sort of initiatives that we do. Because if we're not well mentally, we know we can't be present for our clients. So that's a great free resource for you to look up if you need as well. And that National Academy of Medicine also put out a paper in 2020, which talked about some promising practices that we can do. And it's very much consistent with the other things that we talked about. We have to know that there are valid measurements out there. So I often ask people, how do you measure the well-being of your staff? How do you know if people are burning out or not? Maybe that should be a regular thing that we look at and measure as part of our KPIs, key performance indicators. If you don't have the buy-in of the C-suite or the business leaders, it's going to be hard to do some of these things. So we want to be able to get there. So if you're a leader in your organization, bring us in. Let's see if we can fix some of these things. looking at the environment. As a compliance officer, we're always looking at ways to streamline or simplify processes because we see so much duplication or wasted time out there. The culture and trust in the organization we're going to talk a lot about today. The cost of burnout. The reality is, if you do a lot of these well-being initiatives we're going to talk about today, you're actually going to save money because burnout, turnover costs millions and millions of dollars, even to a small organization. So it just makes good business sense to do the things that we're talking about. And you're also going to be able to recruit and retain people, which again, we know adds to the health of the organization and the people in it. Another great resource here from NAM. These are the elements that really come into play if we're going to have a healthy organization. You got to have that commitment at the top. Got to strengthen leadership behaviors. Conduct that workplace assessment. What's the risk assessment from a compliance perspective? And what are the things about these areas that are going to impact that? It's not just about the facility or infection control. It's really about the health of your people. And looking at policies and procedures, this should all be integrated and part of your policies. Maybe you have a policy on clinician well-being or how you do that and what you do about it. I once had a CEO tell me, May, if we've got this under control, we're taking care of our staff. Once a year, we have a get-together, it's a party, and we have a clown come in, and everyone just really loves it. And I just wanted to caution that certainly that's great. That might be a fun thing to do, but a clown party once a year is not what we're talking about here. We're talking about daily practices that come in that really support clinician well-being and their efficiency and all the things they need to feel connected in the work that they do. And SAMHSA, which is one of our obviously leading resources in mental health and substance use disorders, came out with a resource just about a year ago addressing burnout. They did a study. They started out with a few thousand organizations they looked at and pared it down to 9 that they found across the country that are doing some pretty cool things in their organizations to prevent burnout in their workforce. So that's a free resource you can get at samhsa.gov. Got some great case studies there and examples, and you can quickly implement at your places of employment to see if they're effective. And then please let us know what's working and what isn't, and if you find those things to be helpful. It's nice that we're starting to get this literature and resources out there. And then again, Joint Commission, many of us might be accredited by Joint Commission. They actually all have a compendium of resources at their Joint Commission resources site as well. And they also talk about, assigning a wellness officer, someone who's committed to this work, training for leaders, assessment tools, updating your policies, making sure your EMR makes things easier. If it makes it harder for clinicians to do their work and documentation, maybe some improvements can be made there. As compliance professionals, we're always trying to fix people's EMR to make them more effective and user-friendly. And most importantly, I think, is that support of our peers. How do we and our teams really help each other and make this work easier? Our team at Circa, we have a Monday morning sort of team call all about business. And Friday, we wrap up the week with the team call just about us, where we talk about how are we doing, what's going on, what needs do we have. We'll offer practice of meditation and yoga, tell some stories, just share and support each other. It's a nice way to wrap up the week. It's a nice way to sort of just touch base and make sure that the work and the business is happening, but certainly in support of all of our sanity and well-being. And here's a great example of a job description of what a job might look like if you have a well-being officer, or if it's going to be embedded in someone else's job description. Looking at the environment, looking at the whole person approach, how does our program do that, and making sure that people are showing open-minded to this and innovating ways to make this part of our daily work. And as Brené's favorite quote of mine is, I want to contribute more than I criticize. Obviously, this work is very hard. The things that we do, it's easy to get overwhelmed. It's easy to complain and kind of find things to gossip about and find things to blame and get upset about. But really trying to be part of the solution is the goal here. And if you're not yet a fan of Simon Sinek, he's also a great leader out there talking about the importance of knowing our why, what is our purpose in the work that we do. Finding that meaning really makes it easier to go to work every day. And that's a great little book he has there called Together is Better, actually about bullying in the workplace, which I didn't actually have happen to me until more recently at a job, which is really quite devastating. It can impact burnout as well. But how do we come together, avoid bullying, avoid things in the workplace that make it more common, and working together as teams and organizations? So let's talk about kind of what that looks like in your facilities and the places you work. You probably signed a code of conduct when you went to work, maybe in your employee handbook and the policies and procedures. From an ethics standpoint, we know we've got the competence around some of this. We're going to be ethical. We're going to follow the rules. We're going to be confidential in our interactions with people, follow HIPAA rules, obviously have good boundaries with those that we work with, watching self-disclosure and the dress code and gifts and social media, all the informed consent and the documentation rules, advertising and hiring practices. Not too long ago, I saw a job advertised here in the Texas region where I live. And the job ad was for a treatment center, and it actually said hiring emotionally stable staff. And I thought, emotionally stable staff, my goodness. First of all, who's judging that? On a good day or bad day, I may or may not qualify. And then how do we sustain that when that person comes to work with us, right? Are we an emotionally healthy workplace, and how are we going to keep it? Because it's very easy to drift, even if we're good at that at some point in time. So hopefully our hiring practice is a little bit higher level than that. If that's your bottom, it may be hard to attain and keep that. Obviously, we want to have happy and healthy staff, and hopefully we always maintain that in our workplaces. And having, I believe, a good compliance plan and program is certainly part of that. Sometimes compliance, if you've got an officer in your facility or someone that does it, they might be seen as like the office of no, or the person you don't want to go to. We believe that compliance officers are your friend. We want to partner with you to know what the rules and regulations are. How do we make them part of just your daily work where it's not a headache? It's embedded into the responsibilities you do every day. Whether it's documentation or relationships or solving problems or grievances or complaints, that's all part of what we do in compliance. And we even have all of our national organizations, right? Federal, state organizations, our accrediting bodies, even our professional things like NADAC or NAATP, if you're part of those. These are organizations that hopefully advocate for us, and we hope to be seeing burnout and turnout and culture as bigger parts of that. I recently spoke to the folks at Joint Commission and proposed some standards to them that they could implement that are just as important as the other things around hand hygiene or infection control or fire safety and life safety, but taking care of our people and having us measure and report on our staff burnout and turnover and culture. What if we were held accountable to that by our regulators? Maybe that will help turn the tide a bit. That's my dream. But first, what I believe we have to do is to stop doing some of the things we're currently doing. The blame and the shame that happens, it's always someone else's fault or someone else's responsibility. Burn and churn, we're burning people out. I once had a CEO say to me, May, we're paying these people to come to work every day. What more do they want? What more do they need? And certainly we spend most of our waking hours in our work. I think people do need more and want more from our workplaces, and hopefully we're positioned to provide that. That command and control leadership. When I was an early leader in my career, I was being micromanaged. I was being led with scarcity and judgment and criticism, and being encouraged to be that kind of a leader. And I was told I was too soft or too nice. I had to toughen up, get a tougher skin. And I think part of that is that scarcity culture that people were brought up in. And hopefully that's shifting. It's certainly changing in other fields. Military, retail, Fortune 500 companies are bringing Brene Brown in and doing this work, and we in behavioral health are kind of lagging behind, maybe doing these best practices that we could take the lead on. And I believe all of those things are leading to the ethical crisis that we're in our field right now, which is really about the overdose epidemic. People are dying under our watch because we're not happy and healthy. People's families are being impacted. If you go online and look at addiction treatment, our reputation isn't great, right? Mental health treatment isn't looked at so positively because of the stories in the media that aren't so good. So I hope we can take a minute, stop, and do it differently. And the stop sign story for me is I once went to work for a facility, and it was a really tough organization. The culture really wasn't where it needed to be. And one point, one of the people came to me and he told a story of how someone had gone to him to complain about me as the new leader and all the changes we were trying to implement. And he put his hand up to that person and he said, stop. He said, I'm not doing that anymore. I'm going to give these changes a chance. I'm going to see if I can be part of the solution. So it takes all of us kind of doing that on a regular basis. Stop doing things that aren't working. Stop doing things that aren't effective, and embrace some of these new ways of thinking and doing that are going to contribute to all of our health and well-being. So if you don't know Brene yet, you're going to get to know her today a little bit. But Brene Brown is a researcher out of Houston. She's got all these wonderful books. I often encourage you to start at the beginning, from The Gifts of Imperfection on, as her journey unfolds in her research into shame and resilience, how it applies to individuals, and then teams and organizations, and just culture at large. So the latest book was Atlas of the Heart. It's all about all the emotions that we live with every day, 87 emotions, not just the mad, sad, glad that most of us are aware of. There's also a Netflix series you can watch of her work, and an HBO Max series as well. So great ways to get exposed to her work and what she does, and see how it can be so transformative for you as an individual. Okay, we have to skip this slide. Okay, good. So what Dare to Lead is, what I think is so powerful is it's actually a set of skills that we can learn and that we can teach and embed into our organizations. When we train teams on the curriculum, it's 24 hours spent together. The cool thing is too, is you can do 24 hours over 3 full days. You can do it over a couple of weeks. I've even done it most recently with a team of people, 30 minutes every week for a whole year to get them trained. You can get to 24 hours in lots of creative ways, but when you get those skills, you really see the impact of it. And these skills are measurable, observable, and teachable. You can see it in the workplace. You can see when I'm doing it well or when I'm slipping. And you can also teach it to each other and make sure that we're using it in our daily work. And here are the 4 skill sets: vulnerability, values, trust, and rising. So we're going to talk about those 4, and I'm going to kind of tell you the story for me, how I've applied those in my personal and professional life, to have that daily accountability of how am I doing in these areas, and really the transformative nature of when you do this, it really does shift your life in so many different ways. When I first got trained in the work, I kind of had quite an epiphany. And I called up Bill White, who many of you may know in the addiction world as one of our leaders, right? He's a historian of addiction treatment. When I reached out to him, I said, Bill, I think I have a insight here that our issues in our field of addiction, maybe we're the problem. Maybe it's us. And he kind of laughed a little bit. He said, Maeve, I wrote a book back in 1987, which is when I was entering the field. He said, it's called The Incestuous Workplace, and you should go read it. And you can get the paper at whitepapers.org. It's a large paper, but what he says in that paper is we self-destruct in the face of adversity in our field. With this high acuity, with these high caseloads, with the turnout and the burnover and toxic workplaces, we actually self-destruct. We don't take care of ourselves, and then we affect the organization and the world in general that we live in. So we have to do it differently. And he's been saying that now for 30 some years. Maybe we can start listening and doing things differently. And Brene comes right recently, currently saying the same thing, that if we don't make these barriers to change and to courage aware in our lives, we're going to keep repeating it. We've got to have tough conversations, talk about our fears and our feelings, talk about the trust that happens among teams and in organizations. Don't get stuck in those setbacks or war stories. If we're going to innovate, we have to sort of talk about it, have these tough things. Equity, diversion, and inclusion is an incredibly strong topic, and that's going to be something we're going to keep hearing about. It's a new standard for Joint Commission now that we have to be looking at that. The shame and the blame in organizations, being really clear with our values, and perfectionism, which was one of my barriers to courage over the years, and trying to improve that and change that. So it's interesting to me that sort of the gurus and mentors in my field are all saying the same thing. We have to look at it and do it different. So Brene encourages us in our story to look at our call to courage. And my big call to courage has been my children over the last 21 years now. My son on the right there is 21, and my daughter on the left is 18. And they became my call to courage when I recognized I grew up in a family mired with addiction and mental health issues, and I was going to do it differently and raise a different kind of family and never have my children suffer what I had suffered growing up. So it was very intentional and very careful how we raised our kids. And I realized in that process, the effort and work I was putting in, I wasn't doing the same in my workplace. Work was kind of a place that I went and I put my professional boss leader hat on, but I wasn't the same way at home that I was at work. And I realized maybe the people at work need the same kind of love and compassion, understanding that my kids do. And I think when we shift our thinking that the people around us deserve love and deserve that from us, maybe it'd be different. Maybe we can have healthier people and families and workplaces when we do that. So my kids have been my lessons, and I'm going to share some stories with you about how they've taught me those lessons and continue to even into today. What we're doing when we do this is building that safety container, this place where it's safe to build trust and talk about these things. So every intention, every effort that we make is in contributing to that safety container, or perhaps it's hurting it. So that is helpful to know. And it's that three-legged stool that Brene teaches us. Our thinking and feeling and behaviors all line up. They're consistent, right? We're predictable. People feel safe around us because we're showing up wholehearted in a consistent manner that does feel safe, much like I worked really hard to with my kids. Now I do it in the workplace. And shame, if you haven't heard Brene's definition before, is that intensely painful feeling or experience that we know that we are flawed and unworthy of love and belonging. If we show up at work or in our families feeling shame, it's really difficult to be successful. So in the curriculum, we don't actually talk about shame until about 8-10 hours in. We don't unpack it that soon because it takes a lot of work to feel comfortable doing that. But once we do, things really start to get deep and people really learn a lot. So the first skill is that vulnerability. And as Brene tells us, embrace the suck. No one wants to be vulnerable. What is vulnerability? If I asked each of you, you may have lots of different definitions, but Brene defines it as uncertainty, risk, and emotional exposure. Who wants to sign up for that, right? But again, thinking about parenting, that's what we're signing up for. We don't have control sometimes when we're parenting, much like the workplace. So we have to be vulnerable when we show up and then have the skills to manage that vulnerability. Many of you might be parents like I do. And when my kids were younger, I would play therapist with them. And oftentimes my daughter would be my therapist and I would be the client. And here is a story that one time she was playing my therapist and I was talking and sharing my stress of the day. And as I was doing that, she was doodling. She was making her Christmas list. But at the end of our session, she slid this piece of paper over to me. We would call it a treatment plan. And she called it the solution. I love that she misspelled it. Solutions. She was 10 years old at the time. And what she told me I should do is I should meditate. I should do FaceTime and calling my children and practice gratitude. And it hit me at that moment. This is a 10-year-old telling me what I should do to manage my stress differently. When I was 10, I could not have written such a treatment plan, right? I was in the midst of chaos and survival and all those kinds of things. So it really taught me that when we do things differently, we get a different result. If we do this at home or in our workplaces and our communities, we get a very different result when we show up wholehearted and do the work as hard as we need to do. So hopefully we all can show up with those solutions in our workplaces as well. And then we've got our values, being really clear about our values. No cat posters, not inspirational stuff that sort of says words that we're not living and breathing. We have to really live and breathe them for them to be effective. And here's my example of values. It's my son. My son was a star football player growing up. From the age of 5 in Texas, he joined football and it became his thing. This is a picture of him in high school. As every goal he set, he became an All-American. He became, as a freshman, he was on the varsity team. By the time he was a sophomore, he had an offer to go play at a D1 college football team, and he was a captain by a junior year. And this is his little flight buddy looking up to him. And it just reminds me, people are watching us. Our staff are watching us. They're looking at us as an example. So if we're burning out or we're not being ethical or compliant, they're going to copy that. They're going to follow our lead. So us as leaders have really got to be sure that we're in a place that we're being examples and we're doing what we want them to copy. Otherwise, it might be our lead that's not so helpful. And we talk about trust. Trust is easy to say, do you trust me? Or I don't trust you. I don't trust my team. I don't trust my boss. So Brene breaks it down into 7 different, very clear behaviors that we can actually be accountable to. Setting boundaries. Do we give our staff appropriate boundaries? Can they set boundaries with us? Are we reliable? Do we do what we say we're going to do? Do we take accountability when it's our fault? The vault I love, which is basically if it's not your story to tell, then don't tell it. Gossip and negativity can take over an organization or a team. So stopping that is really critical. Being in integrity? Do we do the right thing? Are we honest? And do we live those values of things that people are going to want to follow? Non-judgment is a great one. Oftentimes we go into work feeling judged by our peers or those above us. And practicing non-judgment can be a really helpful way to approach people so they feel safe sharing both what they need and their fears. And my favorite of these is generosity. That's the idea that people are doing the best they can. We're all showing up each day, kind of giving our best. And some days it's going to be best or better than others. But if we can be clear about that and know that, we certainly approach each other with a different kind of kindness, I think, and compassion than when if we assume someone's doing something just to be difficult or to be resistant. And this is that marble jar idea. If you've not heard Brene talk about it, she talks about trust being built in small ways, like marbles in a jar. It has to be built over time. It's those tiny little gestures that happen each day. It's not a big swooping thing like, I save your life. It's me asking you in the day, how are you feeling, or taking up a shift or doing something different. And this was a marble jar that a team of people that I learned the Brene Brown curriculum with did for me when I left the organization. They each wrote a note of how I got in their marble jar and the time that we were together. Really being clear and specific. How do you get in your team's marble jar? What are they needing from you, and what do you need from them? It's a great exercise to do and then to practice and really support each other in. And the rising strong process is that piece about when we're doing all those things, we're living these skills and we're practicing them every day, we're going to mess them up. There are going to be days where we're just not going to do it well. And will our team come to us and say, hey, it's not working, or this happened? Early on in my career as a leader, when I was being more micromanaging and critical and judgmental, I would have people say to me, Maeve, we like you, we like working with you, but there's this wall. It feels like I can't quite know you. I was sort of being too boundaried and not letting them in, kind of to my circle. And at first I thought they were just being needy and these people are so difficult to work with. And I think that was my own sort of awareness or avoidance of, I didn't want to have to let them in, because that means I would have to, ask them to let me in as well, which is that vulnerability place. But when we're rising strong, we're recognizing I've got to open up. I've got to recognize this and hopefully help each other to get there, which brings the team communication and dynamics to a whole different level of working together and really success. And my daughter is my great example of that. Here's a picture of her playing therapist, as I mentioned earlier, in an old office I had. Here she is wearing my glasses, holding my schedule book, looking a little judgmental there. But I remember in our discussions with her, when she was born in a very different way. And I didn't know what it was. She was young, didn't want to wear boy clothes or girl clothes, wanted to wear boy clothes, wanted to do all these things differently. So I did a lot of research, understanding. I was prepared for mental health in the family, or maybe even addiction. I wasn't prepared for this, that I learned to call gender nonconforming. She's kind of on that line of not sure where this is, right? But she's not following in these gender norms. And especially in North Texas, we like to put girls in bows and dress them up and maybe not be very helpful as they explore who they're going to be. So luckily it was her 16th birthday where she had her best friend over, and her best friend gave her a pride flag. And at the time I was shocked and I said, wow, what does this mean? Getting a pride flag. And she sort of looked at me funny and I said, well, are you gay? And she looked at me and she said, yeah, Mom. And I said, well, where's my big moment? Where's this big reveal? And she just said, you've always known, Mom. You've known before I knew, and I knew that. And again, that lesson she taught me was, do we know our people better than they know themselves? Are we taking the time to really know our people, to know their strengths and their weaknesses and their fears and what they love and what they're, struggling with? And if we don't, maybe we have to get better at that. Maybe we have to take the time to get to know them and learn about them and ask all those questions that lead us to that closer relationships with them, so that we can be as clear for them as they need us to be. And this is why it's difficult, I think, in our work. We forget that our staff sometimes come with us with ACEs. And if you're familiar with the research around adverse childhood experiences, we know that our patients come to us with high ACEs, right? ACEs2high.org is a website you can go to. You can get the 10-question survey, because we know from research that if our clients and our staff come to us with abuse, neglect, mental illness, substance use, legal involvement, domestic abuse, or parental divorce or separation, before the age of probably 5 or so, maybe even up to 10, is going to change their health outcomes for the future. Every health indicator is affected later, from weight to cancer and diabetes, certainly mental health, anxiety, depression, suicidality, addiction. So these things are affected. And so I would start doing the ACEs survey with my staff and realizing most of us have 4 or more, which is what the cutoff is that this impacts your life later. Many of us come, like me, with 8 to 10 of those. So if we know that about our staff, my question is, what are we doing about that? For our clients, we have groups and counseling and equine and massage and all these incredible things. But for our staff, what are we doing? If we're just having them show up and work long days and long hours, maybe we're not helping them to regulate their brains and to make it possible for them to do the work that we need them to do. What that leads to then is an armored up heart, right? We've got staff who are armored up. We might think they're being resistant or difficult or not wanting to work hard, but maybe if they're armored up, it's difficult to do that. And this is what that armor looks like, right? We're either moving forward or away or towards things in ways that aren't always healthy. So if you're looking at your turnover rate and it's not good, if you're looking at your employee engagement surveys or your satisfaction surveys and they're showing things aren't well, maybe it's this armor that we can look at and do things differently in our organizations. BreneBrown.com has wonderful visuals. This is a great example of one, the Wholehearted Parenting Manifesto, which is all about kind of showing up, being our full selves, recognizing that it's time to kind of be loved and lovable, take care of each other, not always be cool, be out of, fun and games sometimes, laughter, song, and dance. In our workplaces, just like in our homes, really can create different bonds and experiences that we all need to generate healthier things in our brains. The wholehearted guideposts are those things that we're constantly working towards. If you read this visual, sort of to the left, we're letting go of control and that perfectionism and the judgment that I grew up in this field being taught was the right way to do it, and cultivate different things like being more authentic and compassionate, being more resilient in our workplaces. If you ever worked for a leader who is joyful and full of gratitude and shares that within our teams, it really can be a different kind of exciting environment to work with. And again, I believe when we have happy and healthy staff, that does create organizations that are happy and healthy, that then get better results for our clients, as well as financial and profits and all those things that can come from having that kind of spirit and environment. And I love this one. This is from Dare to Lead, which is that leadership manifesto, that we're making that commitment that we're going to be inspiring to others. We're going to take the risks with people. We're going to see what's between us, what's challenging us, and not just once a year. Maybe this is a daily activity. Maybe it's something we look at in our performance improvement goals. It's actually embedded that we're going to monitor and manage these things, and it's going to be part of what we do on a regular basis. As Brene says, a leader is someone who takes responsibility for finding the potential in people and has the courage to develop that potential. I shared earlier about my son and how he had reached all those goals and was becoming this amazing leader as he got to his college career. He was doing great with his first 2 years at a D1 school in Houston. And then he got transferred to his dream school at Texas A&M to play football there, going to earn his scholarship spot there. And one day he kind of knocked on the window of my car as I was leaving a visit. He said, something's not right in my head. These concussions are hurting him. And he was scared. He said, something's wrong. Something's wrong with my thinking and my feeling. Something wasn't right. Kind of like I had said years ago with my burnout. So we had to get lots of tests done. And it turns out the concussions had done some damage. And he had to medically retire from that football career that he was on. And again, it reminded me of, as leaders, when we're looking at these things with people, they have to be able to come to us and say they're suffering, that they're hurting, that they need our help. And if they don't, and they're not doing that, maybe something is missing. So we have to be brave and willing to look at that and talk about it, and hopefully have them knock on our door and come to us with those concerns. That's the ideal. And here's what it looks like in practice. I love this visual because oftentimes we say, be ethical, be compliant, just do it, sort of the bottom left side there. But the truth is, it does start on the right side. We have to work through all that uncertainty, anxiety, and fear, scarcity, shame, get to that love and belonging and joy place within ourselves and within our teams and eventually our organizations to get to that left side where things really start then to be different. We're more creative and accountable. We're having hard conversations. And then we're being ethical and being resilient. It's that process of doing this on a regular, continuous basis, just like we teach our clients, right? This is no different than teaching our clients these recovery skills that take daily practice. And this is the arena we're walking into. One of my favorite quotes from Brene is, when you step into the arena, don't puff up, stand there and stand your sacred ground. Know that we're worthy, we're showing up in these places with that place of belonging, and we can contribute to a really positive environment. Again, at BreneBrown.com, all these great quotes that she has, put them on your fridge, put them on your file cabinet, on your desk, recognizing that all these things kind of can refocus us when we fall back into our old patterns of thinking. I'll oftentimes be in a training session or a supervision session, and the old thinking will creep in, thinking this person is being difficult, or what's the problem here, the critical, judgmental, scarcity thinking. And these quotes help me to kind of refocus and know that I want to come from this place as a leader, not the place that I was unfortunately trained and brought up in. Old way of thinking, that armored leadership way versus being a daring leader. And what Brene learned, the armored leadership is really about fear. It's about being seen as unworthy, being seen as not okay. So there's that fear factor rather than being a daring leader, which I believe is really all about love, all about coming to a place of taking care of and caring for people. And this heart was given to me by a supervisor some years ago when she was my supervisor. And at the time, we went through so many changes in the organization and we weathered a lot of storms together. And then she was giving me my evaluation over the phone, which is probably never a great idea, but it has to happen sometimes. And as she was talking to me, she was telling me things need to improve that year, and I wasn't happy with the evaluation. So I texted on my other phone, who I thought was my husband at the time, my feelings about this call. Unfortunately, I made a text mistake and I actually texted that to the boss that I was on the phone with during my evaluation. So she saw what I was saying about her, complaining, being gossipy, being very negative. And she says to me, "Oh no, Maeve, I just got your text. Can we talk about this?" It was quite humiliating for me that she saw what I was saying, in that scarcity mindset. It wasn't very helpful. Luckily, I said, "No, that's okay. I don't want to talk about it." But years later, she approached me at a conference and she gave me this heart. She said, "Maeve, years ago, whatever happened, we were working in a place that was sort of that scarcity mindset, wasn't built on love." And she said, "I love you and I care about you and I want us to be in a different place." And now she's actually quite a mentor and friend of mine, and we've come a long way. And that's what can happen when you're living in that wholehearted space. We can actually support even those difficult, embarrassing, challenging times, as I can attest to. Because what happens in that workplace is you've always got that comparison and scarcity and shame. They're always going to show up. We've got to replace them with compassion and empathy. There's one exercise in the curriculum called How Shame Shows Up in Organizations. And I love this session because what we talk about is what it looks like on our team. And you've got to be really brave to be able to say that. But when we do, it shifts everything because now people are really talking about what's real and what needs to be different. This is a truck that I saw when I went to a training once. I once went to a training of behavioral health executives. And I said to those executives, let's talk about your organizations. How many of you can tell me your revenue, your EBITDA? How much money are you making? How many of you can tell me your census today and how full you are and how great you're doing? How many of you can tell me, your standing in the business and your thriving and how everyone's being successful? And then I said, tell me about your people numbers. Who can tell me here how your staff are doing from a burnout perspective? And they didn't know. They said, we don't really track our burnout. I said, what about your turnover? What's it like on your teams? And of course, they said, well, you have to ask our HR department. We don't really know that. But what about your culture? How do you measure your culture? Oh, gosh, that's a good idea. We don't even look at that. And it really struck me that if we're not looking at our people measures, how do you get the other measures? If you're making money or serving lots of clients or your beds are full, isn't that because of your people? It has to be that. We have to know our people. We have to know that data and then be managing it and acting on it to make it better. And here's an example: the trucking industry might be doing it better than we are, right? their most valuable resource sits there. Their people driving those trucks are important, and they put it on the truck to show that. So I did some research into this trucking company. It's the most profitable in the world. So again, an example of when you take care of your people, you do better, even from a business perspective. The lantern is sort of our guiding light, protecting the flame, doing all we can to make our workplaces safe, things that people can live within their values and do all that trust building. Empathy and self-compassion as the biggest seats in the arena. And then I'm going to share with you that what we're going to do, instead of being fearful or critical, judgmental, is having that grounded confidence, the rumbling skills. What's difficult? What's showing up for us? What challenges are we having is what we're doing instead. This is an example of a marble jar board that I made. People can put comments on the board, how people got in their marble jar. What does that look like? And I had a staff person come and say, can you give me the notes that are about me? She would have nice notes about being a helpful coworker or being a nice staff person from the clients. I said, sure, what are you doing with those notes? And she said, well, I take them home and I put them on my mirror. So when I come to work every day, I can see them and motivate. What a beautiful thing that people feel valued and cared about in their workplace by having this kind of a visual. That's what we want to do, is make it a place they want to come to and want to show up to. I'm going to skip through some of this to get a little closer. Self-compassion, empathy, obviously skills we have to work on. What we're rumbling here, certainly post-pandemic, is that anxiety, grief, and forgiveness. We're all struggling with the fear sometimes of just our jobs and our health and our livelihood. So recognizing that and having that discussion in a safe place can be really critical in our workplaces. And I love creating this space. I call it the heart room. At conferences, I create this space for attendees to come and relax. We might do yoga or meditation. People might just sleep. As you know, work conferences, webinars like this can be kind of exhausting and can be places that are just overwhelming with information. I think finding these soft places to kind of sit and relax can help rewire and regulate our bodies and our minds to receive and retain the information that we're getting at conferences. Excitingly enough, there's this new thing. It's called Open Seed. This is a portable meditation pod that is coming to market. If you look up openseed.com, you can find it. I think Microsoft, some other Fortune 500 companies have now bought these pods. Are going to be put into their workplaces. And I would love it if we had a behavioral health organization start to have these pods. It's a place to go into. You close the door. There's meditation music. There's aromatherapy. Deepak Chopra comes in with meditations guided, which just seems amazing. Then you get that regulatory piece. As compliance officers, we have these 7 elements we have to be following to help us be ethical and compliant. That can be part of our daily work with our teams once we're calm and relaxed enough to receive it. And that gets to that reliability that we talked about. High reliability is maintaining consistent high levels of safety and care over time because these things are embedded into our organization. That's the goal that we're getting to. So if you're interested in Dare to Lead or getting your team trained, I would love to talk with you. You can contact me. Your team then gets a seal that they're trained and a certificate saying that you've attained that accomplishment. And I'll close with just a quick gratitude again from my children, Aiden Delaney. This was a picture, it's probably 7 years ago now, that showed up on the front page of the Dallas Morning News. We were the first family in Salina, Texas to refuse the STAR test, which is a standardized test here in Texas that kids have to take at certain intervals, certain grades. I told you I grew up in a very unconventional family. I spent most of my formative years in New Orleans, in a sort of a hippie commune in New Orleans, and we didn't have grades or schools or tests where we went. It was very different. So I have a sort of a challenge to those formalized school systems, and I just think that the standardized tests don't help our kids to be smart or to be successful. So we decided to refuse it. The TV channel came, and that morning on the Channel 5 News, I heard the commentary say, Salina family refuses a STAR test. And I went that day for a first day on the new job, and the boss approached me and he said, maybe I saw you on the news today. I thought, uh-oh, he's going to know, kind of question things around here. And he looked at me and he kind of got, teary-eyed, and he said, I wish I had a mom like you growing up. He said, I had learning disabilities and I always felt stupid as a kid and never felt like I fit in or was worthy. And every kid deserves that. And again, that life lesson of all of our staff deserve that too. They deserve someone to show up for them, advocate for them. If we don't have these kind of systems in our workplaces, who do we advocate? Who do we ask the right things for? How do we make sure it happens? Because we all deserve that. And hopefully we can build that within our organizations, and as a field, we can do better. So thank you again for your time. I appreciate any last minute questions, I'm happy to answer or respond to. Christy, if you've got any from the chat.
Well, we'll see if anybody's got any questions here. They can pop them into the chat box. While you're doing that, I just want to, first of all, I want to say thank you, Maeve. That was an amazing, amazing presentation. And I actually have Dare to Lead here on my bookshelf. I think that I started that I never finished. And then I think we'll go back and finish it and see.
Good.
And kind of go on this journey with you. So I appreciate the presentation. Everybody, just so you know, this is recorded. It will be on our website by the end of day Friday. Certificates will be coming your way by end of day Friday. Please, please, please check your junk mail. My emails go into the junk or spam folder all the time. So if you can't find it, give me an email and I will get it to you as soon as I can. Let me see if there is any additional. Yes, we will have the slide deck available. I will be including it in your certificate email. So hold tight, as well as a link to our next webinar, which is with Judith Landau and Dr. Michelle Holcomb, talking about co-occurring disorders and why families are key members of the collaborative team. So stay tuned for that information. If you need to get a hold of Maeve, I will have her contact information if you're looking to connect with her and talk to her about any trainings. So again, thanks so much, Maeve. We certainly appreciate the time you took to talk to us today.
Yeah.
All right. Have a great day. We'll see you next month.